The state's chief medical executive revealed today that infections among younger people in Michigan are rapidly increasing.
Early in the outbreak, most new cases were occurring in people who are under the age of 50. But in June, that changed. The rate of new cases is now higher for people under the age of 50, and in the past 2 weeks, the rate of new cases is highest in people ages 20 to 29. 23% of cases in the month of June were in this age group, 20 to 29.
Really interesting. Yeah. Dr. Frank McGeorge is here to kind of break down this really what is a troubling trend, Doc.
Absolutely, Kim. You know, the outbreak linked to Harper's Bar in Lansing, now at over 100 cases, is a perfect example of how social behaviors more common among younger people quickly contribute to increased transmission. Unfortunately, though, the Harper situation is being replicated in communities across the state and the country.
Monday, the My Safe Start dashboard indicated that the risk phase for Lansing has been increased to high risk due to the recent one-week increase above 40 new daily cases per million. More to the point, you can see the distribution of cases by age group in Ingham County clearly shows a dominance in the 20 to 29-year-old age group. Very different than the statewide graph of cases by age that shows the more typical spread of cases we've seen during earlier months in the outbreak. Now, nationwide, other states have noted a similar shift of increasing cases among younger people. The biggest concern is that this is leading to serious illnesses in these people. A hospital in the Houston area, where cases have spiked dangerously high, reported that 60% of hospitalized COVID-19 patients are under the age of 50. Now, in line with that, the CDC's data shows that between April of this year and last week, the percentage of people between 18 and 49 who were hospitalized with COVID-19 increased from a low of 21% to 35%. This increase is likely related to the behaviors of younger people, not because of anything related to the virus itself. Older people are likely doing a better job of protecting themselves, and younger people are more likely to congregate without proper precautions.
Now, the message going out to young people, please wear a mask and distance yourselves. Do it for yourself. You aren't invincible, and the hospitalization data really shows that. Or do it for the higher risk loved ones in your life who might be infected. But finally, just do it because it's frankly the right thing. Don't ruin it for everyone. If we do not slow the spread, we will be heading for another shutdown.
Yeah. A few weeks ago, Frank, we were worried about little kids and coronavirus. Is there any change in the percentage of hospitalizations in children, under the age of 18, say?
Well, you know, the CDC data says that since April, that number has crept up slightly. It was as low as 0.2%. It is now hovering around 1.2%. It's a very small increase of only 1%, but still something to keep an eye on.
Yeah, indeed. Okay. Thanks, Doc.